how well are these ACE interviews being integrated into physician practice, medical school curricula, therapist, counselor training?
Piece of cake.
Yeah.
Not at all.
Thank you very much. Next question.
No. The resistance to using it is enormous.
Why so?
I suspect that there are at least several reasons, one of which undoubtedly is personal ghosts. Presenting this to large medical audiences, 200, 300, 400 physicians. By about 8 minutes, the level of anguish on people's faces exceeds anything that I would be willing to attribute to empathic responses. I mean, it seems pretty clear to me that personal ghosts are being awakened. Furthermore, something unique has happened a number of times. I've had 1 or 2 people explosively leave the auditorium with fits of uncontrollable bronchospastic coughing. I have never seen that happen to another speaker. I've never had it happen to me with a different subject. So in some way or other, this is deeply disturbing to many, many of us. Another explanation. A very bright colleague of mine says to me one day, but what would I do if I asked? And somebody said yes. I'm no damn shrink. I'm a cardiologist, etc. Well, the answer is, tell me how that's affected you later in your life. It works. I mean, what patients have to say is concise. It doesn't open Pandora's box. The answers are remarkably to the point and often help you understand where you need to go next, etc. People are willing to talk about this because it's an enormous relief to find that somebody finally seems interested and understands this and is willing to listen.
Let me ask another question before I go to this, Mr. Swanson here. Dr. Felitti, what is known, if anything, about the childhood background of parents of these abused clients?
Relatively little, because we only had the patients themselves to talk with. And parents in general are not open about sharing their childhoods.
It's an unfair question. Do you have any reason to believe or sense, as I heard a couple of echoes in the audience, that this might be part of a cycle?
I'm not sure what you mean by a cycle.
It happened to them, and it happened to the parents.
Yes, I believe that's certainly true. When you have parents who are not capable, for whatever reason, of supportive parenting, that's going to produce heavily damaged children. This is, by the way, largely avoided by the press. You think of the Columbine shooters and any of the school shooting situations and so forth. I'm always impressed how there's nothing in the newspaper articles about who raised these kids. Were they born and then nobody touched them afterwards?
Mr. Swanson.
You'll notice in 2 of the video clips mention of parental loss through divorce, a hugely important issue that is totally untouched. I suspect because so many of us have been divorced that we really don't want to embarrass ourselves by going nearing it. If you talk with adults who have become obese in childhood, the coincidence of childhood obesity onset approximating the age of parental loss, typically through divorce, is remarkable.
That is the most depressing thing you said all night. Because if that's what our problem is in America, then we are really in trouble given these divorce rates.